Nutrients are one of the most tested topics on the Nclex. But if you understand the why, you will get these questions right every single time. I'm gonna tell you exactly what you need to know. No more, no less, no fluff. Let's go. The UTIs usually start when there is bacteria. That is usually E. coli. It enters through the urethra and it goes up into the urinary tract. But I want you to think urethra, then the bladder. If it's really bad, it will hit the kidneys. This causes that inflammation or that cystitis. And that inflammation that you see, those are the actual symptoms. So a symptom is burning while peeing. That is when the urethra is inflamed. Frequency and urgency, that's your irritated bladder that cannot hold on to the urine. That cloudy, foul-smelling urine, that's the bacteria that's present. That lower abdominal pain that you'll have with UTIs, that is your bladder inflamed. Think of the path of why those symptoms are happening. Here's what the Nclex wants you to know though. This is like a little trap they try to get you. So with elderly patients, they have different symptoms. They will present differently. They might not have those classic signs. They might show confusion, agitation, or that sudden change in mental status. Why? Because that infection and that inflammatory response, it's affecting the brain. Affects that brain function, which causes that delirium. If your elderly patient is all of a sudden confused, think UTI first. When it gets serious, that's when they have pyelonephritis. Because if that bacteria gets all the way up into the kidneys, that's when you're gonna see your fever, your chills, your nausea, vomiting, your flank pain. This is a systemic infection. It's not a localized infection anymore. So your priority is to push fluids, flush the system, flush the bacteria out. Then you can treat your infection with antibiotics. Then you can treat the pain because that burning is very uncomfortable. In your patient teaching, you're gonna teach them to wipe from the front to the back. You want them to urinate after intercourse and have them avoid any irritants to the bladder, like coffee or caffeine. Nclex answer strategies. This is what gets you points on the Nclex. You see an answer option. Ask yourself this. Is this a local bladder infection or is it systemic? Burning plus frequency is UTI or cystitis. Fever plus flank pain, that's where your kidneys are involved. That is a higher priority. Fusion with your elderly, I want you to think UTI until proven otherwise. If it says, who do you see first? Pick the patient that has that flank pain and the fever, because that is a kidney infection and that can lead to sepsis. Don't just memorize symptoms. Know why they're causing those symptoms. Why is the body doing what it's doing? The body is telling you what's wrong. This is how I teach in Simply Nclex. If you like patho breakdowns where it all makes sense to you, go ahead and comment down Simply Nclex or run to the top of my page, grab my study resources now, get studying the right way so you can study less and pass more. Make sure you like, save, share this out. I will see you in the next video and happy studying.